Time to answer your COVID-19 questions. Tonight, though, our focus is on mental health because for many Canadians, the pandemic has unpacked a real struggle with loneliness, anxiety, depression, and honestly, just trying to get enough sleep. So joining me tonight, we have Dr. Gans Ference, goes by Dr. Gans, a psychologist in Edmonton, and Dr. David Greatzer, a psychiatrist at Toronto's Centre for Addiction and Mental Health. Hello to the two of you. We're going to get started because we've got more than a few questions to get through. Dr. Greatzer, let's go to you first. I'm finding it hard to get out of bed in the morning to start my day. Any advice?
Well, that's not entirely surprising. Many of us are in a very different routine than we usually would be because we're not working or perhaps we're working from home. And maybe the best advice here is just trying to stick to a little bit of a schedule. Set the alarm, get up out of bed, try and have some sort of a routine, whether that involves work or other activities, and try and stick to it.
Right. Dr. Gans, take the second one for us if you could. I've heard this one an awful lot. Why am I having such a hard time sleeping?
I would say the same thing. I mean, really, we're out of routine. We don't have the same sort of drive or external structure that we normally have to get up and get moving. So the external routine that we establish ourselves is going to really help us. And then also, if you are having a hard time sleeping, set a steady wake time and just kind of stay with that. And after a while, your body will catch up. And then that will get you back into your own routine. You'll sleep a lot better. And
when it comes to that routine, I mean, Dr. Gans, do you go the whole 9 yards, not just in terms of the time that you wake up, but, I mean, getting dressed as if you're going to work, trying to do every little thing that you would normally do?
I would, actually. You know, whatever we can establish ourselves to get into that normalcy of life is going to help us. It's going to help us to get into that rhythm, but also going to give us back that sense of control that a lot of us are missing right now because there's so much uncertainty. We really need to have that as a legitimate need to have a sense of control over our own lives. So this will really help.
Okay, Dr. Greatzer, I saw you nodding your head there, but let me throw another question at you, and this is a tough one. I'm grieving the loss of my husband, and I'm alone for the first time in 45 years. I feel really alone at a time where I need emotional support. How can I get it?
First things first, I'm very sorry to hear about your loss. What an incredible loss and an incredible time. I think reaching out to friends and family, whether that's by phone or by Skype or other means, would be really useful. Also be aware that a lot of self-help support, a lot of support groups are actually still available. So as an example.
Yeah, go ahead.
Bereaved Families of Toronto, which is a wonderful not-for-profit organization, is not meeting with people in person, but they're still providing a lot of counseling over the phone and over the internet, and there's sister organizations like that all across the country.
And I know a lot of folks have had trouble wrapping their minds around video conferencing. Either it feels overwhelming or they're just not used to the technology. What do you advise on that front?
Try it. It's surprisingly straightforward. As a provider, I listen to doctors and psychologists all across the country explain to me it's not the same online, et cetera, and then they try it and they explain, actually, that was pretty good. So I think the technology is a lot more sophisticated than a decade ago. There's still some nuances, a lot of great resources available online if you're a provider trying to get into this, or a patient trying to understand how you can have a therapy session online. But yes, the technology is there and accessible.
Well, lots more questions I could ask you, but this is just a start of a conversation, I'm sure. Dr. Gans, Dr. Greatzer, thanks so much for your time.
Thanks for having me.